morning, everyone. Don't pay attention to my voice. I am getting over the flu. But to God be the glory. The minute we're going on the fast is the minute I started getting sick. But the devil is a liar. So I thank God I was able to finish that fast with everyone. And it was amazing, by the way. My second time doing it. So to God be the glory. So as Minister Allen stated, this month is a month that many of you have seen, people wearing pink. And so I'm going to go into a little bit about what it is and what it means and what they do to actually talk about. But breast cancer awareness. And remember, it's pink and blue because men get breast cancer, gets breast cancer too. So what is Breast Cancer Awareness Month? So it is an international health campaign that's held every October. The month aims to promote screening and prevention of the disease, which affects millions, and I repeat, millions of women worldwide, as well as a small percentage of men. For some, it is a trigger. It's a reminder of a disease that forever changed their lives and their loved ones. For others, it's a chance to show their support for the millions of women and men around the world who are diagnosed with the disease each year. Understanding the goals behind the global campaign and the emotions felt by many different people living with the disease may help you decide if and how you want to commemorate the month. So let's talk about what is a normal breast. No breast is typical. What is normal for you may not be normal for another woman or man. Most women say their breasts feel lumpy or uneven. The way your breast looks and feel can be affected by getting, for the woman, your period, having children, losing or gaining weight, and taking certain medications. Breasts also tends to change as you age. Being familiar with how your breasts normally feel, such as when you shower or put on a bra, you can make it easier to notice any changes. And for the men, when you exercise or when you're taking a shower, you also can notice if there's any changes. Many conditions can cause lumps in the breast, including cancer. But most breast lumps are caused by other medical conditions. Two common causes of breast lumps are fibrocystic breast condition and cysts, which a lot of women do have that. Fibrocystic condition causes non-cancerous changes in the breast that make them feel lumpy, tender, and sore. The cysts are small fluid-filled sacs that can develop in the breast. So here are some pictures. On my left, your right, is what a healthy breast look like. And on my right, your left, is what a fibrocystic breast look like. So you see you have those little those changes, the little lumpies, and those are the things that can be mistaken at times for breast cancer. When people start feeling it, they start to panic, but don't always panic when you see things, when you feel something like that. You want to make sure that you get it checked, however. For a man, this is what their breasts look like. They do have a nipple, they do have the areola, they do have lymph nodes, right? They have their ribs, they have their muscles, they have fatty tissues, and they also have ducts. So what is breast cancer? Breast cancer is a disease that begins at the growth of cells in the breast tissue. These growth are cells grown abnormally and they form into tumors. The tumors can spread to other parts of the body, which can be fatal. Though rare, this occurs in men as well as women, as I discussed earlier. And this is what a cancerous cell looks like. And as I go on further and throughout the month, I will show more pictures of that. Here's a picture, again, of what breast cancer looks like in a female. My left, your right. My cursor is hovering over it. I'm not sure if you're able to actually see that. And then you have the fatty tissues here, your lobules, your milk ducts, your rib cage, and your chest muscles. The men, the tumors are usually like right here in this area, close to the nipple area, right? They do have fatty tissue just like women. So what causes breast cancer? When someone is told that they have breast cancer, it is natural to wonder what may have caused the disease. But no one knows the exact causes of breast cancer. Doctors seldom know why one woman developed breast cancer and others doesn't. And most who have breast cancer will never be able to pinpoint an exact cause. However, there are factors that put one at risk for developing breast cancer, such as environmental factors, lifestyle choices, and hormones. On the other hand, it is not clear why some people who don't have any risk factors, by the way, do get breast cancer. yet others with risk factors never do. In men, it's not clear, as I say, against why they also get it, but doctors know that male breast cancer occurs when some breast cells divide more rapidly than their healthy cells do. The accumulating cells form a tumor that may spread, which is called metastasis, to nearby tissue, to the lymph nodes, and to other parts of the body. So what are some of the risk factors? I'm going to go over the risk factors for the woman, and some of these risk factors do involve men, but I'm also going to go through the risk factors for the men. A family history of breast cancer. If a parent, sibling, or child had breast cancer, your risk of breast cancer increases. A personal history of breast cancer. If you had breast cancer in one breast, you have an increased risk of getting the cancer in the other breast. A personal history of breast conditions. Certain breast conditions are markers for a higher risk of breast cancer. These conditions include lobular carcinoma in situ, also called LCIS, or a typical hyperplasia of the breast. Beginning your period at a younger age. So beginning your period before age 12 increases your risk of breast cancer. Beginning menopause at an older age, and being female. Women are much more likely than men to get breast cancer. Everyone is born with some breast tissue, so anyone can get breast cancer. And one of the things that they've noted is that even though a lot of Caucasian women are diagnosed with breast cancer, African Americans typically die more from breast cancer. And we'll go more into that later. Other risk factors include dense breast tissues. If you have dense breasts, you have more dense tissue than fatty tissue in your breasts. Having dense breasts can make it harder to detect a breast cancer on a mammogram. Drinking alcohol increases your risk of breast cancer. Having your first child at an older age also increases your risk. Having never been pregnant increases your risk. Inherited DNA changes that increases cancer risk. Certain DNA changes that increase your risk of breast cancer can be passed from parents to child. The most well-known changes is what's called the BRCA1 and the BRCA2. And that is a genetic testing that anyone can get that done. If you do have a family history, your doctors can actually have you checked for that and monitor that closely. Other risk factors, menopausal hormone therapy. So taking certain hormone therapy medications to control the symptoms of menopause may increase your risk of breast cancer as well. Obesity is another risk, and radiation exposure. For men, the risk of breast cancer increases with age, and the average age of diagnosis is 60 or older, but can occur at any age. So let's not just stick to the age 60. Again, if they have a family history, if they have the genetic mutation of the BRCA1 and BRCA2, and what's called a Klinefelter syndrome, which is a rare condition where men have an extra X chromosome, which can increase the risk of breast cancer 20 to 60 times. Estrogen levels. So high estrogen levels can increase the risk of breast cancer. This can be due to a number of factors, including diseases like liver or kidney disease, a heavy drinker, obesity, certain medications, and marijuana use. I want to repeat that. Marijuana use does increase the risk in men. And something that's called the gynecomastia, or excessive breast tissue in men. You see some men, they look like their breast is big as a woman, and they may need to bra. Some people joke about that, but it's something that should be taken seriously and should be monitored very closely. Other risk factors, radiation therapy or hormone therapy as well, and testicular conditions. So certain conditions that affect the testicles, like an undescended testicle, can increase a man's risk of having breast cancer. Work environments. So working in hot environments like steel mills or blast furnaces also increases man's risk of breast cancer. So what are some of the signs and symptoms? Different people have different symptoms of breast cancer. Some people do not have any signs or symptoms at all. So some symptoms include a lump or mass in the breast or underarm, a change in the size, shape, or appearance of the breast, dimpling, redness, thickening, or other changes to the skin of the breast, a change in the appearance of the nipple or the skin around the nipple discharge, especially if it's bloody or happens suddenly. Pain in the breast. It can be cancerous, but it's not always cancerous. Sometimes when you have that cystic breast also, you'll have pain. Swollen lymph nodes in the armpit or above the collarbone. let's talk about this part. So the solar lymph nodes in the armpit can be cancerous, but it can also be from if someone that shaves with a sharp-end razor. So for me personally, I cannot use that razor because it will cause my lymph nodes to be swollen. So I have to use an electric razor or wax. That's just Lisa. Okay, so just be mindful of that. Early stage of breast cancer may not cause any noticeable symptoms. Other conditions such as eczema can cause similar changes in your skin texture of the breast. Solar lymph nodes can also be caused by a breast infection, or other illnesses can cause you to have that. So it's important that when you're having these particular symptoms, or if you're seeing them, that you want to get them checked out. Don't immediately diagnose yourself or anyone, because as I stated, other medical conditions can also cause that. Okay. Now, the signs in breast cancer in men. The most common sign of breast cancer in men is a lump or mass in their chest. This may be felt as a hard, painless lump under the nipple, or it may be more diffuse and feel like a thickening of the chest wall. Other common signs and symptoms include some that is similar in women: nipple discharge, breast pain, or tenderness, skin changes on the breast, such as redness, scaling, or dimpling, nipple inversion. So if your nipples are typically outward, that includes for the male and the female, and you're noticing that that nipple is now going inward, you want to get that, you want to monitor that, you want to get that checked out, okay? A change in the size or shape of the breast, swelling of the lymph nodes on the arms and around the collarbone, again, bone pain, and unexplained weight loss. I hope this was helpful. Please make sure that you are getting your mammograms done when it's due. I know during COVID, a lot of people missed their mammograms, and the end result for many was not very well. We ended up seeing a lot of breast cancer patients in the hospital that were metastasized. Thank you so much for your time. We'll continue this discussion for the rest of the month. Enjoy the rest of the service, and God bless.